From the makers of Tylenol.
All right, welcome back, everyone. A survey released this week says 1 in 5 Americans are turning to social media websites like Facebook, YouTube, and Twitter for medical advice. Sure, plenty of information is out there, but can you really trust it? Our senior medical correspondent Elizabeth Cohen is here with some answers. So how useful are these social media sites? Is it helping or is it hurting?
You know what, Don, I'm going to make a lot of doctors mad by saying that I think they're actually helpful because
empowering patient.
There you go. It empowers the patient. I just hear from so many people that they learned valuable lessons on social networking sites. Doctors are fabulous, but there is no one like someone who's been through your disease before you. For example, if you are just diagnosed with diabetes, you go to Diabetes Mind, go to her Twitter page. This woman is sitting at all of the big diabetes conferences and tweeting what she's learning. And then you can also go to her website, you know, for more details. And you're going to learn something from this woman. She's been doing it for years. She's incredibly smart.
Is she an advocate? Is this her job or something that she just
picked up? No, she was diagnosed with type 2 diabetes, or type 1 diabetes rather, and she has learned, you know, she knows what she's talking about, and she, as I said, goes to these conferences, reads all the studies, and she does nothing but this. This is her full-time job now.
Very interesting. Okay, so you said she knows what she's doing. How do you know? She's a great example, but how do you really know when you log into these social media sites if the person or the advice that you're seeking is accurate and they know what they're talking about?
Right. There are a couple of different ways of doing that. And one of the things you want to do is look at that number. See where it says 3,711 followers?
Yes.
That's a good number. If someone says that they're a real expert, a patient blogger on diabetes, and they have 12 followers, that is not a good sign. Another thing you want to look for, are they trying to sell you something? Because that's a bad sign. They're trying to sell you something, that's not a good sign. And another way to be an empowered patient, right, not a good sign. And the other thing that you want to look for is, do they source their information? Right? Because if they are just sort of saying things without sourcing it, that's not good.
That's what we have to do.
Right.
We have to source the information.
That's right. And if journalists have to, then, you know, people who tweet should have to as well.
Okay. And you said big disease, few followers. Big disease, few followers.
That's not good.
That's not good.
Right. In other words, if someone's claiming that they are one of the big patient bloggers on diabetes or heart disease or whatever, and they have 12 friends, that shows that they're not getting a lot of support, and you might want to look elsewhere. But, you know, I want to show you another one. This is a Facebook page for a woman named Jill Arnold, who runs a group called The Unnecessarian. And so they talk about cesarean sections. So if, let's say you're a pregnant woman and you want to talk about cesareans, you know, here's a Facebook page with these women. That's what they do. They talk about, do I want one? Don't I want one? How can I avoid one? I mean, you sort of have this instant group of like-minded people who you can ask questions
And I'm
of.
looking at this stuff. This is a few things to keep in mind. Very good information. Please keep it civil.
Yes.
No flames. Also, spam is gross, whatever. He's talking about the site, but if you need to tell another person, it seems like if they want to keep the site civil and they want to cite sources, then chances are...
That's a good sign.
And run it by your doctor.
Right. That's a good sign. And they're not trying to sell you anything.
I always learn so much with you.
Oh, well, thank you.
You know that? Have a great weekend.
You too.
Thank you.
You
Good
too.
to see you. Revolt